What is osteochondritis dissecans of the knee, and what can be done about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Osteochondritis dissecans is not a really common knee injury, but you do see it, especially in boys, maybe 14, 15, 16 years old. You can see it in adults, but that is usually a remnant of something that you had as a teenager that either you didn't know about or didn't treat, and then it progressed on to basically a full thing. What it is basically there's a small area of bone in the knee. Typically, it's on the end of the femur on the what we call the medial side, the side closest to the midline. And initially, the cartilage will be intact, but the bone just under it, for whatever reason, will start to die. And it can cause pain, it can cause swelling. As long as the cartilage is intact, especially if it's a young, 14, 15-year-old boy that's not done growing, or even younger than that, you can sometimes put him on crutches, make him non-weight bearing, and it may go on to heal on its own. The trick comes when the cartilage sort of breaks over it, and then that piece can be loose. Sometimes in kids, you can go in and reattach it with pins or screws, but very often you need to actually take out that big chunk of bone and replace it with a cylinder or multiple cylinders of bone and cartilage, even from another area in your knee or from a donor. And in adults, that's very often what's needed. So if it gets to the point it needs surgery, it can be a long recovery because surgery is a big deal. Sometimes it involves actually opening up the knee, not arthroscopically doing it, and then long periods of time getting that bone and cartilage to heal, getting the motion back, strength back, things like that. But it can be difficult, especially if that piece is broken off and you have locking or catching. Non-surgical treatment is really not an option because it just doesn't do that well. Your knee locks up in certain positions, it hurts, and just going in and taking out that piece doesn't do well either because now you've got a big crater on the end of the bone, and that's going to cause wear and tear over time. Have you suffered osteochondritis dissecans of the knee, or some people call it OCD of the knee? I'd love to hear your experience, so in the comments below, describe it. I can't give you specific medical advice if you ask a question, but maybe I could answer it in an upcoming video. But I'd love to read it, and I know people dealing with this from all around the world would love to learn from you as well. Now, I'd like to give you the #1 next thing to do to overcome your knee injury. In the description below this video, the very top link is basically a link. It'll take you to a page where you answer 4 or 5 very short questions. It takes like 30 seconds. It'll help me learn more about your knee injury, and then I can give you the #1 next thing to do or to know to help get you better. All right, do you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention? Subscribe to my video channel. I record a couple of these videos every single week, so click the subscribe button in the upper right corner of the page. They'll get delivered directly to you. Thank you so much for watching. I really hope this video on osteochondritis dissecans was helpful, and I look forward to seeing you right here next time.